And good evening, and welcome to this Facebook Live episode of the Your Health is Important radio broadcast. This is a continuation of Wellness Wednesday, as heard on Wednesday mornings at 8:20 a.m. Eastern Standard Time on the Ricky Smiley Morning Show. We're coming to you live from our medical offices, and we're here to answer your healthcare questions. So tune in, tune up, and let us know who you are and where you're tuned in from. You know that we like to have a roll call at the beginning of our sessions. And so I want to start that off. I'm going to give you a soliloquy. We're going to talk about influenza. It is now respiratory season. I am having, I'm at the end stages of a respiratory tract infection that I was concerned that was going from pharyngitis to bronchitis to pneumonia. I don't think it made the transition, but I did have to treat myself rather aggressively. I have to thank the lovely and talented Mrs. Collier, who did everything from rub my back and held my head in her lap. And unfortunately, now she's got it. So I think that I was the person that passed it along to her, unfortunately. So now she's recuperating as well, but she's just a few days behind me. I think I am about 1 or 2 days away from totally good health again, and continue to take my medications as well. So let's update you on our weight loss journey. You know, we were 30 pounds down, and we decided we were going to back off a little bit. And so we have done that. We have actually started expanding the things we're eating. I weighed myself earlier this week, and guess what? I had lost another 3 pounds. Now, I don't know whether that's because I was not feeling well and possibly not eating much. There were a couple of days where I only had that good chicken noodle soup that you get that fixes what ails you. But I did that, and again, 3 more pounds down. So I'm trying to stabilize at this point. I'm happy with 30-pound weight loss. 35 pounds will give me what I'm doing. So at that point, that gives me about a 5-pound leeway so that I can, possibly get out of hand one day during a football game or a big weekend of fun and frolic. I know my alma mater, Morehouse College, is having their homecoming weekend starting October 22nd. That's Saturday, but the activities will start Wednesday of that week. And so we're going to try to spend as much quality time in and around the campus and seeing old friends, etc. at that time. So this morning, Wellness Wednesday, we talked about respiratory tract infections, particularly the flu, the respiratory syncytial virus, or RSV, and coronavirus, all of which we're expecting to have basically pandemic level infections during the wintertime. Now, the thing about the flu is this: it starts on the other side of the world, so we can get a realistic picture as to exactly what we can expect here in the United States. It started off as far away as Australia. And this year's flu season in Australia, which is now coming to an end as ours is cranking up, was one of the worst flu seasons they've had in the last 5 years. Now, everybody did good with the flu for the past few years for a couple of reasons. One, we were on the COVID restrictions, so you weren't traveling, you weren't out as much. When you did go out, you were wearing masks, you were socially distancing. So all of those things worked wonderfully for preventing and keeping down flu cases. Last year, Texas did not have a single flu case at this time of year. This year they got almost 500 at this point. So we see where we were and where we've come from. In New York City, the incidence is already 500% higher than it was last year at this time. So that's north and south. So we got New York, we got Texas, and Georgia. A large number of children that are infected with the flu and the respiratory syncytial virus. The RSV virus is the #1 cause of hospitalizations in children, and it is affecting children as young as 1 month old. So it is very important that we protect those individuals. There are treatments available, but in an individual that's small and fragile, then they are susceptible to poor outcomes, and that's not what we want with our children. So we're expecting, I was reading in the scientific journal yesterday, there's a new corona variant that is showing its ugly head in various parts of the world, not in the United States as yet, but they always end up here in a very short period of time because we're mobile now. People get on airplanes, and diseases that would be in China and will stay in China, now they readily come to the United States because people travel internationally. So we are going to see where we are with that. But during that week ending October 1st, the latest date for which the data is available, 969 cases of influenza A and 52 cases of influenza B reported by the CDC. Now, Again, 2 types of flu. There are actually 5 types, but there are 2 main types. Type A, which infects humans and seals, of all things, humans and seals. And I'm sorry, type B infects humans and seals. Type A is the bird flu. You would think that type B will be the bird flu, but no. Type A is the bird flu that infects birds and other mammals, including human beings. So the type B is the one that gives you more severe symptoms, but you don't want either of them. Multiple therapies and multiple preventions would include hand washing frequently, covering your face or nose when sneezing, because it is transmitted by respiratory particles. A person coughs or sneezes in the air, you walk into the mist, you get it. They cough and sneeze in the room that you're working together, you get it. They cough on the surface, you touch the surface, touch your eyes, your nose, you get it. So very important that we continue to use basic common sense and some of the things that we learned during the coronavirus pandemic. Again, hand washing frequently, wearing gloves if necessary under certain circumstances, not to be great because most people would touch things with their gloves and then still touch their face, etc. So the gloves didn't provide much protection. But again, a mask that covers your nose and mouth, eyeglass goggles that cover your eyes, because you can get transmission of these bacterial and viral particles onto the surface of the eyes, where they will attach and are absorbed very well, and you blink and they go down the tear ducts, which are located here on both sides of the nose, and it's a direct deposit into your sinus nasal system, and that's how you get infections. So treatment, again, rest, particularly for the flu. The fatigue is so severe you can't do anything if you wanted to. So get rest, plan on getting rest. Don't try to work from home, don't try to do anything but rest, recuperate, and recover. Take an anti-inflammatory such as Motrin, Advil, Aleve, which will not only control your fever, but relieve pain and lower your temperature. Body aches, all these things are helped tremendously by an anti-inflammatory. Tylenol is just a pain medication and an antipyretic. So it will stop you from hurting. It doesn't stop muscle aches, it stops basic pain, and it will help with fever. But it is not as good and doesn't last as long as the other anti-inflammatories, what are affectionately referred to as the NSAID groups, the non-steroidal anti-inflammatory medications that will help control those symptoms. Decongestants such as Mucinex DM. I actually was looking for some this weekend when I got sick. Difficult to find. So I would recommend that you get these things, stock up on them now. I already have them available. Don't wait until somebody in the household is sick. Non-sedating antihistamines are all over the counter at this time. So Claritin, Allegra, Zizal, Zyrtec, all available over the counter. All have great generic versions that are available at the store, where everything was $1, but now it's $1.25. You can buy good quantities of these medications for that price versus the $38 that it cost me to get my Mucinex DM maximum strength. When I subsequently found it for $14, I was disenchanted. So there are also coupons in the Sunday's newspaper, and probably available electronically as well for most stores for your cough cold products. Go ahead and purchase now. Have them on standby before anybody gets sick, and so you'll be prepared for it. Okay, Havoc, that's enough of the solo. Let's start our roll call. Where are you calling from? Who are you? Let's see if some of our regulars are in. What's up? Donnie Nowlin from Tulsa, Oklahoma. Thank you, Donnie, for tuning in. Barbara Jones, hello, Doc. Barbara, so good to see you. Sean, Big Time Green, my hero. Sean, I don't think you missed an episode. I'm so glad to see you. We got to do something special for you, Sean. I'm going to have to reach out to you, DM. CL Turner from Baton Rouge, New Orleans is in the house. CL, thank you for tuning in once again. Antoinette Hunter from Grayson, Georgia. Antoinette, a pleasure to see you once again as well. Miss Makiba Boland, good evening from Douglasville, Georgia. A good friend, so glad you tuned in. Rachel Harrison, hello, Rachel. Thank you for tuning in as well. Tam, Scorpio's finest West. Tam, I'm so glad to see you there. Thank you for reaching out to Mrs. Kaya. That's so kind of you. G-Mon Gospel Fry from Florida. Say, thank you so very much. Deandra Brown, you got this from Fort Lauderdale, Florida. Thank you so much. We appreciate that. Tracy Lockhart Talley. Tracy Lockhart from Fort Lauderdale. Thank you. I hope you did well during the recent storm activities, and that you are safe and healthy, and your family is safe and healthy, and that your housing is intact. You have power and water. Marco Perry. Good afternoon, Marco. Love that the face that you got on that. Thank you so much. Janae Allen. Janae is calling from West Palm Beach, Florida. Janae, thank you so much for tuning in once again. You are a regular at this point. Carol Craig. Hello, Carol. Thank you for tuning in. You didn't say where you were from, Carol. Sharonda Johnson, Orlando, Florida. Thank you. Orlando's in the house. How about New York, California, Texas? Tanya Acton from Owensboro, Kentucky. Tanya, this may be your first time. I don't recall Owensboro being on the list, but thank you for tuning in. I appreciate you. Willette, how are you from Lakeland, Florida? Thank you, Willette. I am feeling better, and thank goodness we were able to do our Facebook Live tonight. Chris Morris, hello from Philadelphia, Pennsylvania. Thank you, Chris. We appreciate you as well. Janetta Roberts Owens from Fredericksburg, Virginia. Janetta, this may be your first time as well. Fredericksburg, Virginia. I love Fredericksburg. Great place to visit. Kim Trying Times Rice. Boy, I love that name. Good evening from St. Louis in the house. Cynthia Benson from North Carolina. Thank you, Cynthia. Denise Irby from Massachusetts. Great. Thank you, Denise. You may be the first person from Massachusetts. Patricia Lee Fwellen from Pat Lee, Columbus, Ohio. Ohio, I love Ohio. Thank you very much. Kiki Cannon from Kingston, North Carolina. Thank you, Kiki. We appreciate that. Essie Weekly from Pflugerville, Texas. All right, Pflugerville, Texas. The P is silent, I hope. Phyllis Fulton from Anchorage, Arkansas. All right. Okay, Phyllis. Iva Hazley from Phoenix, Arizona. Now we got our West people checking in all the way from Phoenix. Great golf courses in Phoenix. Lakeisha Rembert Campbell from Concord, North Kakalaki. Thank you, Keisha. We appreciate you. Stacy Brown from Mississippi. Thank you for doing this and tuning in once again, Stacy. Regina Robinson Fletcher, so good to see you. Really enjoy all your posts on Facebook. Thank you, Regina. We appreciate you. It makes my day. Phyllis Fulton from Alaska. Thank you so much, Phyllis. We appreciate. Oh, Alaska. Is this the first Alaska person that we've had? I think we've had a few more, but thank you, Phyllis, for tuning in. We're going to make you a unique individual from Alaska. Chris Goodjoin from Greenville, South Carolina. Chris, great picture. You on the beach, man. Just chillaxing. We appreciate that. Angela Anita White from Fort Washington, Maryland. Thank you, Angela. We appreciate you for tuning in. Angela Merritt from St. Louis. Thank you. From STL. That's the airport code. Rosalind Collins from Lawrenceville, Georgia. Rosalind, thank you so much for tuning in. Lawrenceville is close and dear to my heart. Big Daddy Still Rocks 29. All right, in Middle Georgia. Big Daddy Still Rocks. I hope you're older than 29, Big Daddy. Phyllis Fulton from Anchorage, Alaska. Okay, thank you. All right, let's get to it. It's time to answer your healthcare questions, which is the reason that we're here on this Facebook Live broadcast. We want to get to it. What natural remedy can I take to get off my high blood pressure medicine? Barbara, I hate to tell you, the vast majority of the time, getting off the medicines is not an option. And it is very important that once you're on medications, that you stay on medications and you stay on whatever number of medications is required to lower and control your blood pressure. It has been said that it takes one medication for every 10 millimeters of mercury to lower your blood pressure. But Dr. Collier has found in his medical practice that oftentimes the response to a blood pressure medication is directly proportional to the need for a response. So if you only need to drop your blood pressure 10 points, it'll drop 10 points. But if it needs to drop 30 points, it'll drop 30 points. And that's the problem with a lot of our high blood pressure in people of color. The numbers, which should be 140 or less, over 90 or less, that is normal blood pressure. Ideally 120 over 80, that's the television normal. But for us walking around, 140 or less, over 90 or less is acceptable blood pressure. But we're not at 152. We're not at 142 over 95. We're at 200 over 120. So we really have to drop it substantially, which usually means at least 3 medications. But you can get 2 or 3 drugs in one pill oftentimes. At minimum 2 drugs. So at minimum, don't hesitate that you will be on 2 pills. And it's better to be on multiple pills at lower doses than it is to be on 1 pill at a higher dose. Because when you're on 1 pill, it's only affecting you one way. So it's skewing you, changing the balance of your blood pressure. And you can only push it so far in one way before you start to have pushback and side effects. So it's better to have 1 blood pressure medicine on the left, 1 blood pressure medicine on the right, each one lowering it so that the sum of the two gives you a greater blood pressure drop without any potential side effects. So there are things that you can do to help lower your blood pressure. Everybody knows about apple cider vinegar is very good for that. Garlic is very good to lower your blood pressure. Black seed oil. The problem is each one will lower your blood pressure maybe 5 points, and you probably need to lower it, 30 to 50 points. So it helps to have it lower, but ideally, bringing it down a little bit doesn't help you. It needs to be down to a therapeutically normal level. If it's not that, coming close doesn't count except in horseshoes and grenade tossing. So you need to make sure that we're taking that. Great question, Barbara. Thank you. Sharonda Johnson, what helps with chronic kidney disease? Sharonda, chronic kidney disease is usually a secondary problem due to either uncontrolled high blood pressure or uncontrolled diabetes, sometimes autoimmune diseases such as lupus as well. So very important that you treat and control those disease states to help keep your chronic kidney disease or CKD in check, because as an end-stage problem, that's one of the things that will result ultimately in renal failure and being on dialysis. So it's important that you save and protect those kidneys. The kidneys are one of the two organs in your body, the kidneys and the liver, that can actually regenerate. So they can be damaged, they can be hurt, they can be even partially removed, and then they'll regrow. And so it's very good that they are able to do that. So they can take many insults, and it usually means uncontrolled diabetes again, or years and years of uncontrolled high blood pressure, because you don't have symptoms until you do. And then once you have symptoms, one of the symptoms may be a diagnosis of chronic kidney disease. That is where the filters in your kidneys are not working as optimally, so they're not filtering your blood. You're not making as much urine, so you're not detoxifying your blood, and you're not disposing of a lot of the toxins and byproduct of your body's basal metabolism that you need to feel better. So kidneys, you have to have good kidney function. A normal glomerular filtration rate, and this is the test that they use to measure kidney disease, should be 60 or higher. I saw somebody today whose was 48. I saw somebody today whose was 120. So it has worked out tremendously that you have that range of kidney function. But again, you got to take care of those primary disease causing entities. And then there are medications that will help protect the kidneys, such as a class of blood pressure medication called ACE inhibitors or angiotensin receptor blockers. Those actually have a benefit, and there are several diabetes medications that now have an indication for chronic kidney disease. Even if you're not diabetic, you can take them and they will help with kidney function. There's also a medication called Carendia, Karendia, that is very good to help improve kidney function as well. So this is going to require a good relationship with you and your medical provider to make sure that you stay on top of it. If you do those things they ask you to do and take the medicines the way they're prescribed. Again, monitor your weight, make sure that you're drinking enough water. That's one of the simple and elegant things you can do. I tell people all the time, make sure you're getting 8 to 10 glasses of water per day, no matter what. And that is in addition to anything else that you are drinking. And if you are drinking anything other than water, that can be tea, that can be lemonade, that can be soda, that can be Jack Daniels. I don't care what it is. Also get a glass of water, and before you get a refill on whatever it is you're drinking, get another glass of water. So when you're sitting there watching football and next thing you know, you've had 2 or 3 beers, every time you grab something to drink that's not water, get a glass of water. You finish the beer, you finish the water, you get another beer, you get another glass of water, and you don't refill until you have completed that glass of water as well. Don't end the night with that same glass of water sitting there untouched, or just have a few sips coming out of it. That's one of my pet peeves. When I sit down at a restaurant, whoever I'm with, if it's me, my whole family, friends, I tell the waitress, bring water for everybody, and insist that everybody drink their water in addition to anything else that they're drinking. It just overall helps with your digestion and a few other things as well. Great question, Chandra. Mary Hollingsworth, I've started on the Max Pack. I'm slowly losing. How many pounds should I expect to lose in a month's time? The Max Pack is very effective in lowering your, in helping you lose weight. There are other factors that can determine how quickly your weight is lost, depending upon whether you're on the 5 meal per day diet plan, which is breakfast, lunch, and dinner. A snack in between breakfast and lunch, a snack in between lunch and dinner. That way your body never feels hunger, so it doesn't store food as fat, but your total caloric intake may be higher than you traditionally have been doing. You have to cut your calorie count by 3,500 calories to lose or gain 1 pound, 3,500 calories. That's why most diets, they cut your calorie count by about 500 calories a day. That's over 7 days. That's 3,500 calories, and most people lose a pound a week. They round it up always to 5 pounds per month. But with the Max Pack, you should double that easily. So either that diet plan or the intermittent fasting, where you're eating everything that you're going to eat within 1 8-hour period. It almost doesn't matter what you eat as long as you don't eat outside that 8-hour period. But of course, you can't be binging on, Krispy Kreme donuts and potato chips and all that stuff, and then drinking sodas and iced tea and sweet tea either. You have to be reasonable about what you're eating, but you don't have to be as sensitive as far as the calorie count is concerned when you're eating everything in that 8-hour period. That is the basis and scientific significance of intermittent fasting and why it works. All right, great question, Mary. Tam Scorpio's finest West. I have to say it. The whole thing is like a pimp called Slickback. Okay. Dizziness and tingling in the fingers, usually when driving. If it's usually when driving, that means it's more than likely an ergonomic phenomenon. That's position of your hands and your arms and your shoulders when you're driving. You have to make sure that your seat is close enough to the steering wheel, that the steering wheel angle is one that you aren't having to reach up or reach down and put and hyperextend those joints, that you're not having to lean forward to look through the windshield because of visual issues. Oftentimes a person needs eyeglasses and they're not using them because they can see good enough, but they're not seeing well enough that it's not creating strain. So they unintentionally will lean forward in an awkward posture. That's put strains on the neck. The strain on the neck puts strain on the nerves that come out of the neck and ultimately end up in your hands. That's the radial nerve and the ulnar nerve, and it's simple and similar to carpal tunnel. Now, because it's happening specifically when you're driving, that's why that's my first choice. But if it's happening in both hands under other circumstances, then it may be something metabolic, i.e. blood flow and or oxygenation of your fingertips, and that's something that would need to be evaluated. But I'm pretty sure, Tam, that it is probably ergonomics. You need to note the height of the chair in your car, how close you are. Make sure that you're comfortable. Because you can reach it doesn't mean it's the best posture for you. So you have to make sure, particularly if you are less than 5'3" or greater than 5'8" for a woman. But that makes it the normal woman's posture is between 5'3" and 5'7". So that's what most things are made. Most desktops are made to accommodate a woman, quote, secretary from back in the day. That's when they designed office furniture, and it was made particularly for a woman that was between 5'3" and 5'7". And so nowadays, particularly with some of these big SUVs and everything that we're driving, they just don't fit you ergonomically without you making some major adjustments when you get in there. And like I said, you can get in and drive and hold on to everything, but it's not. You got to make sure that the posture is ideal for you. So great question, Tam. That might be the question of the day. We appreciate you. Phyllis Sports, I'm 65-year-old with sinus issues in AK right now. Okay, so more than likely those sinus issues are allergy related. And so the first thing I would do is use a saline nasal spray to rinse out any kind of pollen allergens, molds that could be in your sinus cavities. I would take a non-sedating antihistamine such as Allegra, Zyrtec, Zylol, or Claritin. Take that every day. Use a steroid nasal spray such as Flonase or Nasacort. Those are things that you would have to do on a continuous basis, not just when you're having major symptoms, to keep those symptoms under control. Dr. Collier is an allergy sufferer. So I have to take a non-sedating antihistamine in the morning after I brush my teeth. Otherwise, if I wait till later than 10 o'clock, I'm having substantive and significant nasal congestion. Basically, I say I'm snotting all over. And then you get the scratchy, itchy throat. It just doesn't feel good, but it's chronic allergy conditions. But if I take the medication, it doesn't happen. If I find that the pills no longer are controlling my symptoms, I will add the nasal spray. And sometimes it's necessary for me to do both during a high pollen, high allergen season. That allergen can be pollen, it can be trees, it can be grasses. We're in allergy season right now in the South because it's fall, and a lot of fall pollens and things like ragweed are out in the air. And just simply walking from my workplace to my car in that short distance, probably 50, 60 yards, you can breathe enough to get allergens in you, and by the time I get in the car to drive home or drive wherever, you start to have itchy eyes, or your nose is acutely more congested, you're coughing, you got postnasal drip, all of those things. So it's very important that allergy symptoms they can't be cured, they can only be controlled. And so you find out what part of that regimen will control your symptoms. If that does not, you can get blood allergy testing that can test you for various things, including food. So foods, they have a panel for indoor allergens that includes house dust, dander, dogs, cats, etc. Outdoors, which is virtually every tree, grass, and pollen that exists, and various foods. Oftentimes, you can be having a food reaction and not know that that's why you're having sinus issues, because some of the foods that you eat may not cause you to break out in hives or have an asthma attack, but you still are allergic to it and you need to avoid it. So, it's a process to get to the diagnosis, but like I said, you can start treating the symptoms. And if that treatment works for you, you don't need to know the answer. You just know that it's allergy versus I don't know exactly what I'm allergic to, but I know that I have allergy issues and I take this medicine and my symptoms are controlled. Great question, Phyllis. Veronica ain't taking no more stuff, Wallace. Hey, girl, how you doing? Thank you so much. From the 305 in Miami. Had my gallbladder removed and bowel obstruction. Would that be the reason I use the bathroom every time I eat or drink? Yes, when you have your gallbladder removed, one of the problems that you can get with that is a condition called dumping syndrome. It is literally where your bowels are so enthusiastically stimulated that you cannot get through a meal without having to run through the bathroom. Now, certain types of foods aggravate that. So fried foods, fatty foods are the ones that will have that symptom the most. If you're eating baked or broiled or grilled and you're eating small amounts or smaller amounts and you're eating more slowly to give your stomach a chance and your liver a chance to get a little bile in there. Because when you eat those types of foods, your liver produces a caustic substance called bile, B-I-L-E, the green stuff. Everybody's aware of it. That helps digest fatty foods. Well, the gallbladder is a sac that holds a substantial amount of bile, and when you eat that, there's a signal that's sent from your stomach that comes to the gallbladder, and the gallbladder contracts. It squeezes like a perfume atomizer, and when it squeezes, it squirts bile into the intestines to digest fatty foods. Well, when you don't have a gallbladder, you can't get a certain amount of bile, which is slowly being drained from the liver passively. It's not actively being squirted into the stomach. It is slowly, passively being brought into the intestines, but not a lot, and not a lot to quickly deal with a fatty meal. So a fatty meal, a fried meal, those sorts of things, since that fat is not being digested, it forms large lumps that are called colloidals. Though that colloidal effect is to withdraw fluid from your intestines and again give you violent, leaky, wet diarrhea that can be explosive. So again, it requires monitoring of your diet, seeing which foods will do that. There are some other things that you can do that can help slow that process down, that can delay gastric emptying and help you through digestion. But the main thing is avoiding those foods, and you know what they are because you probably eaten it and say, wow, the last time I had fried shrimp or the last time I had some Popeye's chicken, I couldn't get through the meal without having to rush and have explosive diarrhea. So you have to be careful. So now you got to get the baked or the broiled chicken that they sell at the checkout at the grocery store for $5.99. That's actually very good and inexpensive. You can feed a whole family for under $10. You just buy the whole chicken, and then you get some sides from the deli, and you're set. You spent less than $20 to feed a family that normally would cost you if you went somewhere else $50, $60. And so one of the things that I take advantage of, one, because again, that chicken is roasted and broiled. It sits in a bag with all these juices. It's very moist and tender. And it tastes absolutely wonderful. And that won't bother your stomach at all. So you can eat that as pretty much as you like. So again, follow your diet closely. Google some things. Google dumping, D-U-M-P-I-N-G syndrome to get more information about how to keep your colon from giving you that insult. And you probably would benefit from our Lipo Cleanse product, which will slow gastric emptying and will help bind some of those colloidals and not give you such a violent effect. You probably also would benefit from probiotics. So our probiotics and our colon cleanse, what we call our belly fix combo, I think will be good for you. So go to our website, lipodrops.com, get that information and find out how you can help better your GI response to eating after having your gallbladder removed. Great question. All right. What do I think about Berberine? Okay, Darlene shrugs. I don't know what Berberine is. I never heard that term before. I hope it is spelled correctly, but I will Google it in real time and see if I can give you an answer to that. In answering that question, you're going to stop Dr. Collier. We haven't had that happen before. B-U-R-B-R-I-N-E. Okay, Berberine. Okay, it's coming up right now. Okay, it's just this is just a sales site that's telling me what that's getting me to buy it, but it doesn't tell me what it is. So I will Google that, look it up, find out what I think about it, and then give you an answer on the next Facebook Live presentations, which you can tune in and get. So once again, let's go to our lipodrops.com information, learn more about weight loss, general health. Remember, our Lipo Immune product is exactly what you need to help get you through this wintertime twin pandemic, the twindemic that we're going to have of COVID and the flu. The Lipo Immune has elderberry in it. It has zinc and it has vitamin C. All those things you need, the ultimate immune system boosters to optimize your immune response. And so I have to admit that because I was doing well in between seasons, I guess, I stopped taking my Lipo Immune. And next thing I know, I had bronchitis. And so one of the parts of my treatment regimen has been to resume that. Taking that along with, I always take my omega-3 fish oil and my probiotics. Those are daily functions. And again, for weight loss maintenance, I'm using the Keto Max preparation, which I take one capsule in the morning, one capsule in the evening. This I'm crediting this with maintaining my weight loss, and I'm hoping that I'm going to go to just one capsule now because I don't want to lose anymore. I just want to stay where I am. But as I stated, I have started to eat more, and I have not gained. If anything, I continue to lose. And so this has helped tremendously. But you can see my shirt collar, and this is a new shirt. I had to buy smaller clothes, and this shirt still giving me 2 inches of finger between the collar. Chin is tight. On a daily basis, people notice. My patients come in and say, "You lost weight. You lost weight." I said, "Yes, I have." "What did you do?" And so they're very interested, and I share it with them, and they either get product from here at the office or they go directly to the website, lipodrops.com, because they want to join this weight loss posse that we have going on. Okay, next question, Habit. What is a probiotic? Tried culture for a month. Activity worked better, but got tired of eating so much yogurt. I have self-diagnosed IBS. Okay, so our Big Daddy Still Rocks. Our probiotic that we have, our lipobiotic product, is very, very good because it has multiple cultures, and probiotics are nothing but good bacteria. And the key thing about probiotics is this, that you have multiple colonies of good bacteria. The unit of measure is colony forming units, or CFUs. And that unit of measurement needs to be in the billions with a B. So billions of colony forming units that will stabilize your gut, improve GI function, help with every allergy symptom, asthma symptom, eczema, skin issues, you name it. Probiotics are just God's gift to GI and immune health. But the problem is that there are probiotic products out there that only have one type of culture bacteria. And if you get it predominantly of one strain, that's going to create an imbalance. You want to have multiple strains that keep each other in check, so you never have overgrowth of one, because if something happens that one turns bad for whatever reason, your body doesn't like it, doesn't tolerate it, you become allergic to it, all kinds of things, then it's not going to work for you as well. But again, many in this situation, great doses, each one in the lipobiotic, multiple cultures. Each culture is in the billions of colony forming units. So very important that you get a product, as you just saw, that you have to get a product that meets that criteria, and that's when you're going to get your best response. Any Greek style yogurt will do it. Activia is a brand name that has high concentrations of good bacteria, but basically any Greek style yogurt, any flavor that you like, will give you that same benefit. But as you have learned, one, they take up a lot of refrigerator space. Two, you get tired of eating yogurt. So I will take the probiotics on a daily basis. I still have yogurt. I have yogurt in the refrigerator right now. I particularly like banana strawberry flavored. And they're always on sale at the grocery store, 10 for $10. And so I'll get those, and then I have them for either my breakfast once I get to my office, or midday snack if I've eaten anything else before the midday snack. But either way, I will get the probiotics in with either the lipobiotic product, which is available on the website, lipodrops.com, or I eat the yogurt. Sometimes I do both, but I tell you, maintaining good GI health is a no-brainer. It keeps your stomach flat, no bubble gut, helps with food allergy responses. And so, again, makes you have large, easy to pass bowel movements that are not malodorous. So, of course, they don't smell wonderful, but they also don't smell so foul that you have to close the bathroom for 30 minutes so the next person can go in there. So just great things that you can do to help with your GI health. So go to the Lipo Drops website, lipodrops.com. Look at the probiotic product, one that I highly recommend. Okay, great. Next question. What's the best way to lower cholesterol without medication? Denise Irby, one, don't eat cholesterol. So if you become a lacto-vegetarian, don't eat anything that doesn't have a mother or a face is the optimal way to do it. But who wants to do that? We socialize by eating. We have dinner meetings. We have dinner dates. We have dinner and a movie. We snack while we're watching football, basketball. And so food and eating is a part of those things that we do in life. Again, ideally, if you have issues with cholesterol, your preferred method of food preparation is baked or broiled, not fried. So baked or broiled, not fried, and that's any food. And then people ask, well, what can I eat? I don't have to give you a menu. What I can give you is general advice that you can use anytime you're going to eat. And that is Dr. Collier's famous catchphrase. If it swims, you can eat it. If it flies, you can eat it. Except duck. Duck is one of the highest fat foods. That's why people love duck so much. And that's why ducks float on water and regular birds don't. So chicken, turkey, all of those are very good food options. And again, virtually any type of fish, the deeper the fish swims, the better the omega-3 fish oils are in that. So bottom feeding fish are the best fish for omega-3 food sources. There are other supplements like omega-3 fish oil, which will lower your cholesterol. Red yeast rice is a great supplement that will lower your cholesterol. And again, your preferred method of food preparation, baked or broiled, not fried. Next question. I'm going through menopause. What can I use for weight loss? Angela Merritt. Angela, menopause for you, menopause for me. Menopause for you, menopause for me. And that is why the hormonal changes that happen at that stage in life make it difficult for you to lose weight, even if you're eating healthy and exercising. So aerobic exercise regimen is ideal, but it's more important to get your hormonal status together. Bioidentical hormone replacement therapy would be life-changing for you because it makes you the way that you were when you were in your 20s and 30s. So, regular hormone replacement, the kind that's most popular, the kind that's most readily available at your doctor's office, particularly your OBGYN's office, is Premarin therapy, Premarin and progesterone if you still have a functioning uterus. Again, will give you some benefits, but bioidentical hormone replacement therapy will be life-changing. It will, again, increase your energy level, increase your muscle mass, decrease your body fat, make it as easy to lose weight as it was for you back then, and also just make you feel better. You just feel no hot flashes, none of the other signs and symptoms of menopause. Bioidentical hormone replacement therapy, ladies, listen carefully. Makes your vagina thick and makes your vagina moist, wet, and receptive, which means you are ready and prepared for intercourse. It makes intercourse more enjoyable, more pleasurable. It makes your orgasms 10 times more intense. So it is probably than you've had at any point in your life. People thank me literally for, quote, improving that aspect of their health. And men say, thank you for giving me my wife back. Or I don't know who this tiger is. She's never been this way. And they appreciate that. So I really like to treat men and women together as a couple when I'm doing bioidentical hormone replacement therapy, because I don't like to hypersexualize one person and the other person is, not quite ready to handle that new situation. But Google bioidentical hormone replacement therapy, BHRT, and that will help. In addition to that, all the Lipo products, the Lipo Omega, the Keto Max, and the Lipodrops Maximum formula are very good for people that are in your circumstance, that point in life when your metabolism is slowing a little bit. The Lipodrops Max are excellent for restoring rapid metabolic changes to help your body more effectively and efficiently metabolize foods. So it's not stored as fat, it's digested, and then the food that has been stored as fat is started to be released after about your second week of therapy, and you just start to literally melt. So it is amazing how well it works. And so those are things and options that you have. Go to our lipodrops.com website, get information on the weight loss products, and see which one will best fit for you, because it specifically talks about women who are menopausal. Okay, great question, Angela. Tam, Scorpio's finest. What are my thoughts on milk thistle for liver health? Tam, let me tell you, Scorpio's finest West, milk thistle is God's gift to liver health. I have had patients who have been near death with liver failure, and they have been placed on milk thistle. In addition to all the other things the doctor were treating with, they went to a naturopath who placed them on milk thistle. And I was really not as cognizant of that therapy as I probably should have been. But again, it's a natural therapy. It's not what they would prescribe under normal circumstances. I was shocked and amazed to watch this person's liver enzymes return back to normal and their liver function test return back to normal from, again, near-death experience, talking about liver transplant, etc. So milk thistle is absolutely great for liver health. It's one thing that I do recommend. Again, if a person is having liver challenges, they can have hepatitis, they can have alcoholic cirrhosis, they can have fatty liver, all of those things. Milk thistle will give you some great benefit. One good thing about it, worst case scenario, it won't harm you. Best case scenario, it will help tremendously with your liver disease. Great question. Damn, I don't know what sparked that question, but maybe you know somebody who is in that condition. But I highly endorse that as therapy. In addition to, this is adjunctive, which means this is in addition to, not instead of any of the therapies that they may be on. Great question, Tam. Kathy Atoro. Okay, what do you think about hemp derived from gummies? Doesn't matter whether it's derived from gummies or not. Hemp is an absolutely wonderful product. Fortunately, it's now pretty much legal in probably 48 of the 50 states, I think. And remember, hemp is the medical marijuana process that does not have THC. And hemp is great for everything from making clothing, cloth, ropes, you name it. But the benefit of hemp, there's an entire neurohormonal system that responds to hemp and the stimulus that you get from hemp and CBD oil and those types of products. And they have been shown to help with everything from indigestion to insomnia to anxiety. The great thing about this is basically totally benign. They should not, if you have a good product that has been purified, it should not cause you to fail a drug test if your employer does drug testing. There's no crossover. You shouldn't have any problem like that. Only some of these contaminated bootleg products that are out there, which basically have higher levels of THC by design. So you'll want them and you'll like them, but those are the ones that can get you in trouble. But your standard CBD oil products are pretty much available everywhere now. Great benefit. The problem is that most people underdose. There are products that are available as little as 100, 200 milligrams total, and complete waste of time. I would say 600 milligrams would be my starting point. Don't hesitate to go to 1,200, 1,500, 2,000. Whatever it takes to give you the benefit that you need, you will respond. You will respond virtually every time. The question, again, is reaching a therapeutic dose level. I have patients that have been taken off of anti-anxiety medications, taken off of sleep medications, taken off or lowered the dose of pain medications that they were on because they are now getting great relief from hemp-based products. So again, great thing I like about them. And people, it comes in liquids, it comes in edibles, it comes in gummies now. I did not think gummies would be so popular amongst adults, but boy, was I wrong. People love gummies. I'm looking at adding gummy type products to every product that's in the Lipo line that can be converted to a gummy because people like gummies. And so if that will increase your enthusiasm to help you taking it, I will be happy to do so. So I'm working on that right now in real time, trying to see how I can convert some of these capsules into gummies for our Lipo Drops product line. Okay, great question. I just started Manjaro. Any advice on helping with the side effects of nausea and diarrhea? Yes, Deandra, Manjaro, thank you. I'm glad you started it. It's going to work wonderfully for you. But as you see, nausea and diarrhea are big products for you, or big potential side effects. I found that yogurt is one of the best things, but really it's probably putting anything on your stomach so that your stomach just isn't empty, because the Manjaro delays gastric emptying. Any food that you eat will stay in your stomach for a longer period of time. Side effects can include burping, hiccups, etc. But the nausea, and one, you will get over it no matter what you do in a short period of time. It goes away. You just have to hang in there and doing so. And I hope you're on the starting dose of 0.25. If you're doing that, that will go away. Some people complain about constipation. Some people complain about diarrhea. If you're having diarrhea, you probably just clean yourself out, and that will go away as well once your colon is empty. But the probiotics I found help tremendously with that. as well as eating yogurt on a daily basis, sometimes 2 cups a day, just to have something on your stomach so it's not empty. But you may get the same benefit from, almost anything that's the same or similar than yogurt. Just don't eat ice cream. Okay. All right, Deandra, let me know how you do on the Manjaro, because the weight loss associated with Manjaro is thought to be equivalent to that of gastric bypass surgery, of up to 30 pounds per every 100 pounds that you need to lose. So research is saying that this may be a replacement or a non-surgical option for people that need to lose large amounts of weight in short periods of time. So I have not had a single patient that has not had success with this product, and I'm talking about dramatic success. So I have had patients that, again, had some side effects, had to slow the dosing down, increase the period of time between dosing, but everybody that hung in there and got through it, they are doing extraordinarily well. And again, once you've been on it for 2 to 3 weeks, it's not an issue anymore. Okay, great question. Mary Holmes, my toes feel numb. I can barely bend him, and he has sensitive feelings in them. They just try to feel like they're tight at all times. Okay, I'm not quite sure. I hope those some typos in there. But if your toes are numb, that means you have peripheral neuropathy, and that means that the nerves coming from the small of your back are not. There's something going on before they get to the toes. So it can be something from fallen arches. It can be a neuroma in the foot. It can be shoes that don't fit appropriately. Oftentimes, we try to wear the same shoe size that we wore when we were in our 20s, and our feet have grown, and we still wearing the same shoe size. We're wearing shoes that obviously compromise our toes, particularly ladies, because they wear the pointed toe shoes, which are, you just can't get through the evening wearing them. That's why you see ladies at parties pull the shoes off and walk around barefoot or change shoes to flats, because it's just so unpleasant to wear heels. It can be something in the small of the back. It can be sciatica or degenerative joint disease in or around the lumbar spine. This is something that you need to have evaluated. You can start with your primary care doctor. You can go to your podiatrist, or you can go to your orthopedist. At minimum, I would say the podiatrist or the primary care doctor first. And then if it's beyond their expertise, then you can go to the orthopedist if it requires more than that. But orthopedics or orthopedic surgeons, which means they operate. And so that's their primary mode of therapy. They operate. And so something that could be treated more conservatively sometimes becomes a surgical problem because you went to a surgeon, and surgeons do what surgeons do, which is operate. So again, more conservatively, you probably would do well by seeing your primary care provider, your family physician, or your internist, or your friendly neighborhood podiatrist. Outstanding specialists, really dealing with anything in the lower legs, not just the feet. And so they can get to the bottom of this problem as well. But don't keep going. It will only get worse. And once your feet are bad, you cannot think about anything else. You can't get through your day. You cannot function. You start to compromise one side or the other, which throws your whole body dynamic off. Now your lower back is hurting. Now your shoulders and your neck are hurting. You're having shoulder pain, back pain, headaches, possibly even blurred vision. Your health will deteriorate when your feet are aching. So it's important to get on top of that as quickly as possible. Great question. Next question. Okay. Letitia Lewis. Are there any known side effects to Lipo Drops? There should not be, because it is perfectly natural. It is a combination of amino acids. So unless you were allergic to one of the fillers, or say the flavoring that gives it its background minty taste, you should not have any problems with it. It is compatible with virtually any prescribed medication, any over-the-counter, any other supplements that you can take. Remember, all you're doing is holding it under your tongue for 2 minutes and then spitting it out. You can swallow it if you like, but the work is done from being absorbed under your tongue. So side effects should be weight loss. There should be no other. It should not make you hyper. It does not have any stimulants in it. Shouldn't cause headaches. Should not cause heart palpitations. None of those issues, because it does not have stimulants in it. That is what differentiates the Lipo Drops from a lot of other weight loss medications that have stimulants in them. They increase your metabolism artificially, which can make your blood pressure go up. We can make your you can get the digestive issues like diarrhea. You can get just all kinds of palpitations of the heart, all those kinds of things with various types of other weight loss medications. But none of that is in the Lipo Drops. It's specifically made, again, to be safe in virtually anyone who wants to take it. So no combination. But if for some strange reason you were concerned, I would share it with my prescribing doctor who's giving you the other medications. Let them know, see if they have any concerns about it. I cannot imagine that they would. You can DM me and we can get, to the bottom of is there any other questions or things you should be concerned about. Thank you, Letitia. We appreciate you. Sheila Battle. I am well. Thank you very much. Feeling better. And now on my, again, 8th day of resolution of this bronchitis. I'm starting to hear it in my voice right now. So thank goodness it'll be time to take my second dose of medication in just a little bit. Regarding natural ways to boost adrenals. Thank you very much. Sheila, natural ways to boost adrenals. There are various supplements that can do that. I would think that, again, actually a product like the Lipo Drops will probably help boost adrenals. But then there are other various, some of the things such as curcumin and turmeric, I think would help boost your adrenal function as well. Specifically a drug that targets adrenal or a supplement that targets adrenal. I can't name one in particular. I would recommend that you go to a place like the Vitamin Shop or GNC where they have counselors that you tell them what your issue is and make sure that adrenals are actually the problem. That's a very unusual thing that they need to be boosted. Most of the time, overstimulation of the adrenals is a problem, and they, can create problems with tachycardia, fast heart rate, very difficult to control blood pressure, etc. But low adrenals is again a rarity. But again, the answer to your question is you probably can get some counseling on that to see if they have any other things they recommend for doing so. So thank you, Sheila. We appreciate that. I love your profile picture. Tanya Durham. Seems like Monkeypox has not been talking more. What happened? All of a sudden, just curious. And the polio outbreak in New York. Girl, you be reading the news and watching some CNN and some Fox. Okay, that is very good because monkeypox is still out there. It's just been dwarfed by the flu right now. And again, the monkeypox vaccine drive has helped tremendously in curtailing. Also, people understanding now the behaviors that have resulted in monkeypox and some of the hot spots where monkeypox was being spread. I just judiciously, they have, shut down some of these, places where people were going and having sex with multiple partners in a very short period of time. You just go and stay in a place all day and have sex with different people all day. They're limiting that behavior now because of things like the monkeypox. People are taking precautions. A lot of people that were in the highest risk populations have either gotten the vaccine or have already gotten the monkeypox and gotten over the monkeypox. So again, the highest risk group, men that have sex with men, but not exclusively limited to those individuals at all. There have been cases of women getting it that were not having sex with anybody. Children that were under the age of 5, not even in school, not in staying home, not going to daycare, not going to anything, that have had monkeypox infection. So it can happen and has happened. The polio outbreak in New York City, again, seemed to hit hard quickly. And then it just kind of, falling by the wayside a little bit. I think because, again, polio vaccines and the usual and customary activities to avoid a viral infection transmission have been in place. But you would think with school in session, kids around each other all the time, that it would, if it was going to be, quote, a true outbreak, that we would be having more of it. Again, it just may not be being reported as effectively as it has been. Great question. I like people that are well informed. Okay, next question, Albert. Okay, Cheryl White. I have sickle cell trait. On a few occasions, I get sickling and end up in the emergency room. Would you recommend getting an oxygen tank to travel? No, not if you only have sickle cell trait. Yeah, that's a little bit dramatic. Don't go into high altitude areas like Denver or Colorado or places where, the air is thin. You would have problems in those areas. The number one reason that people with sickle cell trait have crisis type symptoms is they get dehydrated. So very important that you stay hydrated. And as I was saying in the very beginning of the show, if you are drinking, you should drink 8 to 10 glasses of water per day. If you are drinking anything other than water, then you need to drink a glass of water along with your Coke, your tea, your lemonade, your juice, your Gatorade, whatever it is, even Gatorade. You get a glass of water, you finish that glass of water before you get a refill. Most people, 2 full glasses of a liquid is enough to get you through a meal, get you through a session, because your stomach just starts to fill up with those fluids. And you now understand this. Calories that you get from liquid foods, iced tea, sodas, exactly. Your stomach does not recognize those calories the way that it would in food. So you can sit there and eat relatively healthy and blow your entire function by drinking sodas or drinking high fructose corn syrup types of drinks or sweet tea. Number one most high calorie thing that you can drink is your traditional Southern style sweet tea. Who knew? You know what number two is? Gatorade and Powerade. They have more sugar than virtually anything else you can drink besides sweet tea. Who knew that that was the case? I have recommended Gatorade and Powerade forever, and then actually was doing a presentation on things to drink for rehydration. Found out that they all have that much sugar in them. So that is why they came up with the G2 formulation and Powerade, because they have lower sugar contents. And as you see, a lot of commercials on some of these newer products, they're telling you how low they are in sugar compared to the products like the Gatorade and the Powerade. Okay, next question. What is the best anti-inflammatory for folks that take high blood pressure medication? Donnie Nowlin. Donnie, great question. Because one of the best anti-inflammatories you can take is Motrin ibuprofen, but that can cause elevations in your blood pressure. Of all the non-steroidal anti-inflammatories that are available, naproxen or Aleve is the over-the-counter version at 220 milligrams. Naproxen prescription strength comes in 375 and 500 milligram tablets. They have the least effect on your blood pressure. But then there are other medications that are not non-steroidals. They are COX-2s, such as meloxicam or Mobic or cefaclobid or Celebrex. Those are very good that you can take to decrease inflammation when you have high blood pressure. The body's natural anti-inflammatories, guess what? Vitamin D. Make sure that you're taking vitamin D at a dose of 5,000 international units per day. Very difficult to find. So get a vitamin D product from our website. The doctor's D is 5,000 international units. That will, I have patients come in, there's a test that I can do to check for information called a erythrocyte sedimentation rate or SED rate. There's another one called a high sensitivity C-reactive protein. Both of those are inflammatory markers. They were always elevated in people who have low vitamin Ds. You get the vitamin D up, those numbers come down. Inflammatory symptoms such as joint pain, muscle aches, etc. go away. So anti-inflammatories are used for chronic inflammation like arthritis, and acute for painful situations like a sprain, a strain, neck pain, etc. So anti-inflammatory is very good to take. I also recommend that people take anti-inflammatories before getting a vaccination, a vaccine of any type, including the flu, the COVID. You start taking the anti-inflammatory the day before, you take it the day of, and take it the day after. You won't get the sore arm, you won't get a lot of the inflammatory side effects that you would get with the vaccine, but you still get full immunity status from that. So it's a simple and elegant solution that I recommend, and I tell patients all the time to do so. All right, Donnie, great question. Glenn Williams, what are my thoughts on CMOS gel? Glenn, I love CMOS gel. It's just one of the ways that it is prepared. It comes in tablets, it comes in capsules, it comes in gel, it comes in gummies. Again, but the bottom line is that CMOS is a great supplement. It helps with digestion. It helps lower your blood sugar. It helps with inflammation. It helps with allergies. So it's very important. It can do a lot of good things for you. It's a lot of bang for its buck in one product. So CMOS gel, again, right up there with black seed oil, CMOS period, regardless of whether it's gel or not. Black seed oil are things that I recommend and highly recommend for as supplements are concerned. But remember, supplements are just that, supplemental. They are in addition to, not instead of. So if I give you a cholesterol lowering medication like atorvastatin, Lipitor, rosuvastatin, Crestor, then you can still take the CMOS if you like, but that's not instead of the prescription medication. You'll get greater benefit from doing so if you take both products. Havoc, I think we got time for one more question. Let's do it. Can bioidentical hormones increase the risk for breast cancer? I was using a cream and now I have atypical lobular hyperplasia. Okay, creams are a type of hormone replacement that you don't have to take orally. Not the same as bioidentical hormone replacement therapy, but again, having a history of breast cancer is one that you have to take into consideration. But for people, for instance, men with prostate cancer, they thought that they couldn't take bioidentical hormone replacement, and so they said you could never take it if you have a history of prostate cancer. Then they said you could take it 5 years after you've been quoted healed and a cancer survivor. Then it says start taking it 2 years. Then there are people that start bioidentical hormone before they even complete their cancer therapy, so they don't lose their libido and a lot of the benefits that they get from that. So that is a unique and individual case, but there has not been any documented cases where bioidentical hormone replacement, which is not what you're using, you were using cream, which is basically the same hormones that I was talking about, just in a cream form, but they absorb through the skin, but it's still estrogen and progesterone. It's not the bioidentical types. Causing a cancer, making a cancer worse, or having a negative effect as far as cancer are concerned. But if you have a history of cancer, if you have a family history of cancer, that means a first-degree relative, a sister, a parent, then you would have to be concerned. That would be part of the history that would be gathered before you would be placed on bioidentical hormone replacement therapy. Okay, that was a great question. That'll be our final question. And we are now going to bring this show to a close. So we want to thank you for being a regular listener. And remember, when you tune in to Facebook Live, to the Your Health is Important radio broadcast, then you are tuning in to have an interactive conversation with the doctor. You get to ask your questions and you get your questions answered. We hope that you find this beneficial. It is always my pleasure to be here as your medical ready reference. I am your humble servant, Dr. MJ Collier. Listen to me live on the Ricky Smiley Morning Show, Wellness Wednesdays, that airs on Wednesdays morning, 8:20 a.m. Eastern Standard Time. We'll see you next time. Thank you so much for a great show.